I've been looking for a house with no walls or no whispers, no hiding places, no secret sister. Been looking for a house that won't shelter a lie, no tear-stained past or reason to cry. I wanna live in a house of love.
Welcome to Empowering Women Everywhere. I am your host, Nan Gill, and today our guest is Ingrid Lucas. She is a speech pathologist. She received her Master of Science degree at Columbia University, and she maintains certification in speech-language pathology from the American Speech-Language Hearing Association and is licensed in the states of New York and New Jersey. Wonderful to have you here.
Thank you.
Ingrid.
Thank you for having me.
So, tell us a little bit about what a speech pathologist does and what your passion is in the field.
That's a great question because I think a lot of people don't realize the scope of practice that a speech therapist or pathologist could do. A lot of people have a little bit of a tunnel vision thinking speech therapist, speech teacher just works in schools, which we do. I myself have a very medical background, so we do the whole gamut from helping people in nursing homes, in schools, private practice, which I've done all of the above, and children through geriatrics, the elderly, the whole gamut with the age range as well. Some disorders, diagnoses that family members might experience needing a speech therapist for would be children on the autism spectrum,
Okay?
children with any kind of developmental delay, or a loved one, adult with Parkinson's, MS, any neurological issues going on. And then there's just a handful of people have unknown reasons why they are having any speech, feeding, swallowing, or memory problems. Yeah.
Okay. So, what does, like for children,
Mm-hmm.
okay, you said something about picky eaters or?
Yeah, so feeding is a big component for speech therapists to handle.
And I would never have thought about that.
And you can get help for it. Exactly. Yeah, most people don't realize that you can get help for something like that, especially those kids on the autism spectrum. They're very picky eaters. They have sensory problems. So they have very limited unhealthy diets. Their top 5 foods tend to be macaroni and cheese,
Okay.
chicken nuggets, hot dogs, pizza, and chips. There's no fresh fruits, fresh vegetables.
Now,
But-
where do you come in?
I come in to help expand that diet repertoire, to getting them to eating the things that they're not eating, so their diet is more balanced. Because those kids, you tend to see other health issues. You know, if they're eating all processed foods and a lot of sugar foods, sure, they're gonna have a hard time sleeping at night or focusing in school. There, you do see a connection with some behaviors that might be there, other medical problems going on. And on the other end of it, with adults, let's say you have Parkinson's disease or you had a stroke. A lot of times there's physical impairment with the swallowing process, which is what a speech therapist would help you do.
Now, how would a speech therapist help you with swallowing?
Good question again. We do a lot of exercises. Oftentimes
okay.
it's a muscle impairment issue that causes the swallowing. Food gets stuck in the throat or it's hard to initiate the swallow. And that's where I would come in, or a speech therapist would come in to help rehabilitate what you had lost.
Right.
Yeah.
Okay. What does the term apraxia of speech mean?
Apraxia of speech is a coordination problem which results in a lot of articulation issues and overall then reduces speech intelligibility for children or adults. Could be childhood onset where you're born with it, or adult onset where you get it because of a neurological insult, injury to the brain and the motor areas affected. So you work on a lot of motor planning therapies with those children or adults.
Okay.
Yeah.
And what kind of work do you do with autistic people?
We see lots of children with autism, whether on the spectrum they're mild in their diagnosis to severe. Sometimes it's as simple as working on attention span. Some of these kids have very fleeting attention span, eye contact, some of those social skills. Other times it has to do with communication, imitation, getting them to say more words, communicating their basic needs, their thoughts, their feelings. You tend to rework those goals a lot with kids on the autism spectrum, because as they change, they're still needing goals to be addressed, but they change as well. A lot of social skills for sure.
Okay.
Yeah.
And I understand that you also are doing work with patients that have multiple sclerosis.
We try. We're trying to do more help with adults. Individuals with multiple sclerosis tend to see changes with their voice and or swallowing.
Right.
And same with Parkinson's and neurological issues. You'll have voice issues, so it's hard for them to speak at times or
Right.
generate their voice. Sometimes they do have dry mouth, difficulty swallowing, and you will also see sometimes a combination of a mild form of dementia with some of these motor illnesses like Parkinson's or MS that we would require speech for as well, with memory.
Okay, so when you work with them with speech, you do certain exercises.
Correct. So there's a specific voice protocol called LSVT, Lee Silverman Voice Training, and that's specifically designed for patients with Parkinson's disease to help rehabilitate their voice. A lot of that principle you can carry over and use or utilize with other impairments with someone like MS that might have similar voice
Right.
changes. I always say to clients, and that's why I try to go out and educate them, if you get this type of diagnosis, it's great to start with a speech therapist before you start seeing changes, because it's easier to maintain skill level than to try to recoup a skill level.
Oh, okay.
That makes sense.
Yeah.
Yeah. So I've gone
So
out.
on the onset,
Yeah.
they would come to you, and then you would give them certain exercises
Yep.
to do to maintain,
Yeah.
and so that they would not lose their ability to speak.
Exactly. It's about slowing the process down and exactly. You just don't want to lose it. You want to maintain as long as you can. And speech therapy doesn't necessarily eliminate a lot of those changes, but it definitely can ward off that for a period of time. We help caregivers a lot, family members, with coping with some of these and bridging the gap with communication problems. And realizing that too, especially with adult speech therapy, doesn't necessarily mean it's this long-term rind and grind of going to see a therapist for a year.
Right.
It could be 6 weeks. We get you on a plan of care. As long as you're independent, doing these things at home, that's all you need.
Right.
You know, so it's more education for adults.
Right.
Yeah, whereas the children
more
are longer
education,
term.
yeah. So this is Empowering Women Everywhere. I'm your host, Nan Gill, and we're sitting here chatting with Ingrid Lucas today about her speech, here I go,
There you go.
about her speech pathology
Yes.
practice and how she actually helps people maintain their speech if they're suffering from anything like dementia or Parkinson's
Yeah.
or multiple sclerosis by doing the certain exercises.
Sure.
And it's not something that you have to consider for a long time, but if you, as an adult, come in, she can give you different exercises to do and you can maintain yourself.
Mhm.
So that's good news for
Perfectly
everyone.
stated. Yeah.
Good news for everyone.
Yes.
So.
Yes.
And then you're also doing some work in the community as far as education-wise
Yeah.
to bring the community up to, the knowledge of what you have to offer.
Yes, definitely. Being aware that there are resources in the community is important. Going to the MS and Parkinson's support groups to talk to them about the types of therapies they could potentially utilize or should consider utilizing in speech therapy. And realizing that we're here to offer that. Also providing free parent workshops in the area for children who are picky eaters has been my passion. It's my area of specialty, actually. because it is a big problem and a lot of parents struggle with it. And just even as a mom myself, I see how frustrating it can be when you have kids that are picky eaters. So I'm sort of living it and I'm practicing what I preach with that a bit, because it is hard to work on that. And a lot of people truly do want their children to eat healthy, and they understand that they should be doing that.
Correct.
So I've done a bunch of those workshops as well.
Okay, so if somebody wants to have a workshop for one of their parent-child groups or one of the school groups, they can just get a hold of you?
Absolutely, yeah.
What number would they call?
Just the business line is 845-243-3133.
Okay.
And they would just let us know where they'd like us to speak. And I've tailored it anywhere from 1 hour to 2 hour. And it's really great. It's really well received. We've had some of our venues were at the Warwick Library, the Albert Wisner Library.
Okay.
Did it for the PTA at Park Avenue School. Those were the two recent local venues.
Two recent
yeah. I've done other school venues, one down in Rockland County. Just really all over the place, quite honestly. So
give Ingrid a call if you want to set something up. It's
Definitely.
her passion.
Yeah.
She wants to get the word
It
out
is,
and educate the community on what's available and what can be done.
Yes.
And that there are tools out there that can help you.
Absolutely.
And what is your website?
It's www.lucasspeechpathology.com.
Okay. So for
a
all
little
of
wordy.
you that aren't too sure about how to spell pathology, we'll put it up on the screen
Sure.
for you.
Sorry about that.
No problem.
We tried other domain names. It just, one of those things, didn't work with getting the LLC and the domain name all synced
to be
up.
the same.
Yeah, it's not
Yeah.
always easy with what's registered and available.
Correct.
So, yeah.
Definitely. So I understand that you're doing some work with TRICARE.
Yes, we are a network with Lucas Speech. We are a network with a number of insurance companies. TRICARE is our latest and greatest, and I say that because they service our military members, and we have Stewart Air Force Base right in our backyard, and a fair amount of military families in the valley, and so we became a network with them and trying to spread the word to them that we're a resource for them to use. Blue Cross Blue Shield's another insurance company we accept, and Aetna, funny enough, we're not in network with, but they do reimburse, so they have out-of-network benefits. So I always tell clients or new clients, don't worry if you necessarily see if you're in or out of network, because sometimes there are ways around that.
So basically, your services are covered for the most part.
Yeah, there's a fair amount of coverage that we can get through insurance companies, and I also have a contract. The business has a contract with the state to service preschoolers. So if you have a kid that's 3 to 5 in preschool, we can do it through the school system as well. So
cool.
Yeah, we have a very small amount of clients are actually cash paying, where it's really directly coming out of their pocket. We can find ways.
So you could basically give you a call to talk about coverage and see whether or not your coverage would handle what you need at the time. And you're very happy to speak with people on the phone and educate them about what's going on.
Yeah.
And your number again is?
845-243-3133. Other thing I think is important to note, the adult care services, they don't advertise a lot for that, and I have really seen in the Warwick Valley area and the lower Hudson Valley, a lot of the elderly or people who are homebound in their adult age population don't really feel like they have a lot of resources locally. I am contracted out through Evercare, Full Care, and Will Care, who are adult home care agencies.
Okay.
So I'm not in network with Medicare, which a lot of those customers would have. But they can, through those 3 agencies, get services and get home care speech therapy down here. It's just something that those companies don't advertise much of. Feel like they advertise Middletown and North, or Rockland County South. And there's this little bubble here where they don't realize that, yes, like we can service those areas.
Well, basically, if they have any question about the service or whatever, they could just call your office.
Absolutely.
And
Yep.
check out your website.
And we explain exactly to them who they should contact so that the whole thing's set up. Yeah, make it as easy as possible. So,
Perfect.
yeah.
Perfect. So this is Empowering Women Everywhere. I'm your host, Nan Gill, and we're sitting here chatting with Ingrid Lucas, who's a speech pathologist, and she's located in the Hudson Valley. But if you're in a different area and you need information, she's available to share with you. Would you travel to give a workshop for young children?
Absolutely. All workshops typically are done throughout the Hudson Valley area. And then even providing services are either school-based, we go there, or home care if need be, or in the office. So we
We have a pretty wide reach with the show, so Manhattan is also an option if somebody wants to make Ingrid go
New
down
York
to
City.
Manhattan. She's
I used
there.
to live there. I love it there. That's a little bit of a stretch. But the Hudson Valley, the lower Hudson Valley area for the time being. So I have speech therapists that work with my agency, and we're anywhere from Minnesink all the way down to Warwick and kind of the whole circle, Chester.
Well, we're going to get you to go to the city if somebody wants a workshop.
Absolutely.
Okay.
As a businesswoman, I've always learned just to say yes, figure it out, say yes, keep going forward.
That's
know,
it.
So,
Because there's so many people that might need assistance.
Yeah.
And it's an educational thing at any rate.
Yeah. No, New York City's great. I lived there for 7 years, so it is my old home. So
Yeah.
we
We love New York.
I know. What isn't to love about it? The food.
Everything.
Entertainment,
And it's so close to the
It really
Hudson
is.
Valley.
It's our backyard, and it's great. I actually, early on in my career, since I graduated from Columbia, that's on the Upper West Side, I did go back and a number of years speak. I'm trying to think of the name of the class. Their practicum class, talking about home care and the advantages and disadvantages to the graduate students there in the master's program. Because it's hard to realize why you should or shouldn't do certain jobs right when you're a new therapist, and so I have gone back and visited and spoke down there.
It's important, you know, to keep your ties with your, past.
Yeah.
And kind of move on to the future.
Yes. Always.
So speaking of the future,
yes.
what would you like to see in the next few years with your
company? That's a great question. We're always growing, which has been great. I opened in 2011 and in Warwick, and ever since then it's been baby steps in the beginning, and now I feel giant steps happening, and we have now 4 full-time speech therapists working, and we are trying to have more of a balance for our business. We're very heavy based with servicing school-age children, and we're trying to really do more outreach with the aging population and all these neurological issues that they have that come with that, whether it's dementia or if it's MS, Parkinson's, a stroke, Lou Gehrig's, ALS, some of the more rare diseases. Right. There is a big need for that, and we're really just trying to reach that population, have a little more balance in our practice.
From what you said, if you're able to reach someone who may have dementia and give them those exercises, it may diminish the speed in which the dementia takes over.
So important, yeah. And even just the frustration, and not just for the client, but the family itself, if there's a breakdown in communication, it's very frustrating to try to figure out how's mom or dad feeling today. Are they hungry? If they're not communicating those things.
Right.
To be able to bridge that gap while you're trying to rehabilitate some of that communication. It's just overall very important for a lot of people's frustration level even, and comfort. It's quality. It's about quality of life issues, a lot of those times, and helping prioritize some of the goals. We get a lot over the years, when you work with these types of people and clients, some more serious issues come up because I'm a feeding consultant and I do a lot with swallowing issues. Do we do tube feeding? What happens with dementia? A lot of those patients stop eating, and helping a family figure that out and make those decisions. That's where a speech therapist comes in. Yeah.
Okay.
So, yeah.
So basically, you want to work more with the elderly.
Yeah, it would be great to
people
have.
that are, suffering from
Yeah.
multiple sclerosis or
Sure.
from Lou Gehrig's disease
Mhm.
or one of those.
That, fortunately, is a little more rare, you see. But it does happen,
So for someone with PHP or
Mm-hmm.
Lou Gehrig's disease, you
Yeah.
can actually help them.
In a sense, yeah, you help them to compensate as things change with their body and to
Right.
keep them eating as safely as possible for as long as possible. Because there's this type of clientele is always at high risk for aspiration, meaning when they swallow, the food goes the wrong way
Right.
and it goes into your lungs. You get pneumonia. It's a whole list of problems.
Right.
So we want to make sure everything, the diet is always modified to meet that person's needs, to make sure they're safe. But it's so important to be able to eat by mouth. I mean, that's how we show love, right? If you know someone who's sick, you want to feed them and take care of
Exactly.
them. That's how you love them. So for a family to have that component stay there as long as possible when dealing with a sick family member is really the sweetest thing you can do for quality of life. And I know all these people are here needing services, and there are other services available locally, but to get someone very experienced and do home care is a little hard to find up in our neck of the woods.
Right.
So we are
And
here.
I would never think, when I thought of a speech pathologist before I met you,
I know.
I just thought of someone that helps a child when they're learning how to speak.
Mm-hmm.
Perhaps they,
Sure.
they may have a hearing problem and they're not able to enunciate certain words or whatever.
Yeah.
But what can cause that with a child other than hearing? What are some of the other...
With the language delay or articulation,
Right.
That's a great question, because that's usually one of the top questions of one of a few questions a parent will ask me is
Right.
like, why is my kid not speaking?
Right.
Or why are they changing these sounds? Sometimes, if it's an articulation-based issue, it could be caused by an anatomical issue happening with the tongue and the palate and the mouth, the arch.
Right.
If tonsils or adenoids in the back of the throat are swollen and there's something happening with that. Most of the time that's not usually the case, and they just don't know why little Johnny is messing up his S sound, let's say,
Right.
and lisping that. And interestingly too, what we're seeing more and more of from dentists are referrals for clients that they want to put braces on, but they have an overbite or their teeth are shifting because they have a tongue thrust when they swallow. It's called a reverse swallow pattern.
Uh-huh.
A speech pathologist treats that as well. We have a swallow right program which we follow, and we correct that problem, because what will happen is if you get braces, you fix the problem, but not the tongue pattern, the teeth are going to shift right back.
Oh, okay.
And so we're...
Things I would have never thought of.
Yep. So we're starting to see more of those clients as well, actually, to work on that so they can get the braces and that their teeth will stay nice and not shift again.
Right.
So it's interesting that happens. But yeah, language delay again too. If a kid is just for some reason just slower learning for whatever the cause is, there's usually a big question mark with little kids unless there's a set medical diagnosis. And sometimes you see that. You also tend to see it too in children who are premature. I will say they just tend to lag the first 3 years.
Right.
And first 3 to 4 years. They're just playing catch up. And that's okay. And I tell the parents they're doing what they need to be doing. It's just taking them a little longer.
Right, because the exercises that you give them will help them catch up.
Exactly. And really the goal for school districts, I find, is getting them to where they need to be by the time they start kindergarten. as best as we can for their articulation, their language, memory, attention span, all of that. They just want all these skills as close to where they need to be so they could thrive in kindergarten, and that's always the big push with
It's
little
amazing,
ones.
because you always think of kindergarten as just a place where you go to play.
Oh,
But
it's very
not that
academic
anymore.
No, it's become so academic, and yeah.
Kindergarten.
I know. Sometimes
Are you ready for kindergarten?
I know. It's true though. It's true. You have to think about those things, and parents really do. And the standards have changed so much over the years.
Right.
So kindergarten from when I went is not kindergarten from now when my daughter starts next year. Yeah. So.
Yeah, well, they're teaching them how to read, and
Mm-hmm.
so so that basically,
Yeah.
it's not a bad idea to
Right.
have your child evaluated
Right.
to see if there's anything that they need to do,
Yeah.
or do any of the exercises that you have available
Absolutely.
to give them a head start when they go into school.
Yeah, and I actually offer all parents a free 15-minute consultation over the phone, and we can discuss in detail what's exactly going on with your child, because sometimes you don't necessarily need to start right away, and it's okay to do a wait and see approach. And I really sort of hash that out a little bit with parents up front. And there have definitely been plenty of families. I said, it sounds like everything will be okay.
Right.
Just sit tight, you know.
And your number to call?
845-243-3133. I say that very clear because people think there's a 2 in there, not a 3. So 3133. Yeah.
Very good. So tell me, how did you get involved in speech pathology?
Let's think here. Digging deep. I remember growing up in church, one of the parishioners there became a speech therapist. Her daughter had cerebral palsy and became a speech pathologist in order to help her daughter. Right. And it kind of opened me to what that was and all the things you could do, the scope of practice with speech pathology. Fast forward, I'm in high school, and I am thinking, okay, I got to go to college, and what do I want to major in? And really thinking about my life, I knew I wanted to do something in healthcare. So I was thinking about nutritionist, physical therapist, speech pathologist, and when I really just looked into the scope of practice and the variety of things you could do with speech therapy, all the places you could work, the different age ranges and disorders that you can deal with, it seemed that I could always keep things different and exciting, and it wasn't going to be the same old all the time. So I just thought in those terms, is really kind of got me into it and wanting to just be in healthcare and help people. It's
amazing the range of people you can help with speech pathology.
Yeah, absolutely. And like I said, I have experienced everything from doing home care with visiting nurse services, working in nursing homes. I have a lot of medical experience with working at Valley Hospital for their pediatric outpatient center, at Jersey City Medical Center, doing an internship at Columbia University, at Columbia Presbyterian Hospital there. So I've seen the most rarest of disorders like Guillain-Barré syndrome to the most common of problems with both children, babies, adults, geriatric, the whole range. So I just really, the more I learned about it, I just thought, there's so much I can do with it. I'll never get bored.
Well, it's really been a pleasure having you on the show.
Thank you. I'm very excited.
We've learned so much about speech pathology.
Yes.
I'm going to have to take one of your classes.
I'll let you know when the next workshop is. No problem.
Okay, definitely.
Absolutely.
And thank you so much for coming.
Thank you. This was great. Thank you.